Hello, Mr. Johnson.
Yes, I'm Mr. Johnson.
Hi, I'm Susie. I'm your occupational therapist today.
Hello, Susie. Nice to meet you.
Nice to meet you as well. Are you familiar with what occupational therapy is?
I'm not. Could you explain it to me, please?
Sure. So I see that you have an injury, and it might be preventing you from doing the things that you like to do or want to do. So what occupational therapists do is try to get you back to those things it is that you want to do.
Great. That's exactly what I need.
Good. So I understand that you had surgery a couple weeks ago, and you're here now. What led you to having surgery? How did you injure yourself?
Well, we got the big snowstorm the other day, and I was out shoveling my neighbor's driveway, and she's elderly, so I go over and I help her out a bit. So I slipped on a patch of ice and went to brace myself on the way down and put my arm out like that and landed on it, and I guess I broke my arm.
Okay. Yeah. Yep. I see from your chart that you had broken your radius of the arm, and unfortunately, it wasn't just a break at the radius where there was damage, but it also had damaged your radial nerve at the same time, and that's the surgery that you just had a couple weeks ago. So at this point, do you have questions about that surgery that you had, or why they needed to do that?
No, I forgot what the radial nerve was. Can you explain that to me?
Sure. So the radial nerve extends through the back of the arm and comes to the forearm here. At that point, it actually breaks into two separate nerves. And the nerve that damaged when your radius broke, and the radius is right here at the thumb level of the forearm here. So you broke your radius right here, just below the elbow, and it was the deep portion of the radial nerve. It's also known as the posterior interosseous nerve, and that's what was damaged by your actual bone there. It caused that damage to the nerve.
Hurt like the dickens.
Oh, I bet it did. Sorry. So yeah, once that nerve was damaged, and the injury you had, not only is it the bone repair that needs to be done, but also the repair to that radial nerve. So the surgeon went in, basically kind of tied that nerve together, and so that it can heal from there.
Okay.
Great. So you're here 2 weeks after surgery.
Mm-hmm.
What we're doing is we removed that bulky compression dressing that you had on after surgery. We're actually going to replace that with a lighter compression dressing today.
Good.
And yeah, that's going to help prevent edema, so swelling of your arm there. Do you have any questions at this point?
What does recovery look like?
Okay, good. And that's what we're here today to get started on is that recovery process. So at 2 weeks out, what we're going to do is, like I said, get that the lighter compressive dressing on. We're also going to fit you with a splint that's going to immobilize at the wrist and keep your wrist in extension a little bit. So we don't want your wrist going like this. That could damage some of the repair that was done. So we want to immobilize the wrist so that it has time to heal, and also keep it at extension of about 30 degrees. So that's like this, about 30 degrees, so that you can heal for a little bit. And then what we'll also be having you do is some exercises with your fingers. We want to make sure that you're keeping moving while you're healing as well. And so there'll be some active and passive range of motion exercises with your fingers now for the next few weeks.
Will I be able to grab stuff?
So no, you're not going to be able to do any grabbing with that left hand. Good question. You do still have the right hand. Is that your dominant hand?
It is, yeah.
Okay, good. That is good. However, it doesn't accommodate for not being able to use your left hand at the same time too. So there are some ways that we can talk about adjusting some of your daily activities to see if there are better ways to do it with one hand, or utilize other equipment that might be able to help you with that while you're recovering and wearing that splint on the left hand. Okay. All right. So as far as splinting, you're going to have that in a splint starting now that we'll get you set up in. For 2 weeks, it'll be at that 30 degrees of extension. We'll come back at 5 weeks post-surgery, and it'll go to 20 degrees of extension. 6 weeks post-surgery, that'll be 10 degrees of extension. And after that, a week after that, we'll go ahead and discontinue the use of the splint. And from there, we'll start with some range of motion exercises for the wrist. So then you will have healed enough in order to do some more movement there in the wrist and not cause damage to the surgery that you had done. So are you having to take time off work now because of this injury?
I am, yeah. I can still go to work and work on the computer with my right hand. But
Okay. All right. And hoping to return back to work then once?
yep, as soon as possible.
To full work with both hands?
Yep.
Okay. Yeah, so what we can do too is at about 8 weeks, we can start with some work conditioning program. And what we'll work on in that will be some strength and conditioning of that left arm and wrist and fingers so that you can have a full day's work typing at the computer if that's what it is that you're doing. In the meantime, we can see if there might be some other ways to adjust your use of the computer. I'm sure typing is challenging with just one hand, so there might be some easy or cheap voice software where you can just speak and have it type for you. That might be something you can utilize in the meantime, and we can look at that too.
Great.
Good. So yeah, at about 6 weeks post-op, then you won't have a splint. You'll still be using the exercises. That'll be really important. We've covered a lot of information. What other questions do you have?
I think, how long will the whole process take?
So the whole process overall from when you broke the arm and damaged that radial nerve, that deep radial nerve, the posterior interosseous nerve, to when the recovery from the surgery, that's going to be at about the 8-week range. Now, full recovery of motion, that really is going to be dependent on the damage to the nerve and how well it recovers. And that's something that's yet to be seen at this point. But in the meantime, we'll certainly work through some of those range of motion exercises, active and passive, and try to get the strength and endurance back as you're healing from the surgery.
Okay.
All right. So another portion of the treatment too is you're going to have a scar from the surgery itself, and we want to make sure that that doesn't tighten up as scars might have a tendency to do.
Mm-hmm.
So pretty much right away now we'll be able to do a little bit of massage on the scar with lotion, and that will help keep that skin a little bit looser so it's not tightening and causing any discomfort there. So make sure that you're doing that as well.
Okay. Is there any specific lotion I should be using?
Probably a lotion that's not going to agitate sensitive skin, so something that's dermatologist approved. That would be my suggestion.
Great.
Okay. And then as far as safety or precautions, while you're healing, it's really important that you're following the guidelines that we have on this handout about using the splint initially. It's going to immobilize your use of that hand, and it's really important that you're doing that continuously, because if you start moving it even on accident, if you're not wearing that splint, it could cause some damage then. Another important thing is when you're doing those exercises with coming up in the next few weeks, is also try not to overdo it. Not only is it important to do those exercises, but don't overdo it. So if you're feeling pain, that's the time to stop. That's what you can use as your gauge and adjust accordingly. So if it's hurting when you're doing those exercises, dial it back a little bit.
Perfect.
All right. Great. Any other questions for me?
I don't think so.
Okay. Well, we'll see you back here in a couple of weeks, and it's been great working with you.
Thank you very much. I look forward to it.